So hi everyone, I'm Eric. I am a senior product designer at CareMessage, and I want to thank you all, honestly, just for being here today. And I'm really excited to talk about how language access drives health equity, and to share a bit of a special project that we worked on at CareMessage. So. What are we covering today? So I want to cover a little bit of my background, share a little bit of my story, and then I sort of define what health equity is and the overall problem in healthcare when it comes to marginalized communities. And after that, I'll dive into the work that we're doing at CareMessage and the mission for the future. And then also I want to take a deeper look into our design process and focusing on how we bridge the gap with our appointments reminders languages expansion project. And finally, I'll hopefully wrap up things and with a closing message, and hopefully have some time to answer some questions, because I am really excited to hear, especially from junior designers, and those designers are like kind of like going in there trying to get their first job. So awesome. So let me tell you a little bit about myself. So I was born in the Bay Area, born and raised in the Bay Area, but I spent much of my childhood in Aguascalientes, Mexico, where my parents are from. When we moved back to the States, I experienced a bit of a culture shock, right? Like I think anybody would. So like new language, new foods, and just a lot of football. After high school, I went straight into the workforce. I wasn't interested in continuing my education at that time. But after working in a warehouse for a couple of years with like no real growth, I decided to enroll into my community college where I majored in architecture. And fun fact, I've probably visited every major tech company campus in the Bay Area, but not like what you expect with like a special visitor's pass. Like I had the worker's pass. My warehouse job involved moving like and storing furniture for tech giants like Facebook, Google, and Autodesk. But being on those campuses like really opened my eyes to the possibilities out there, and I really wanted to be sort of part of that world, and I just didn't know how to do it yet. um, Fortunately, I shifted gears and transferred into San Jose State University for graphic design, and just graduating right before the pandemic. I earned my BA in design studies, and then soon after, I started working as a UX UI designer at an ed tech startup. And yeah, so I know it seems like I sort of just jumped into the UX and UI role, but to be honest, it was a tough battle, especially when you're first generation and you really have no real connections. So that's really where Techqueria really comes in. After 2 years at an ed tech startup, I stumbled upon a product role at the Techqueria community Slack group, where I met Cecilia, who is our current chief strategy officer now. And she gave me a real opportunity where many companies didn't, right? So I'm very, very grateful for that. And just having the opportunity to just even connect with her through the Techqueria community Slack. So just keep looking out there and connecting with people on there, and it does work. So obviously the rest is history. And now I'm a senior product designer at CareMessage, designing products for underserved populations. So before diving into the awesome work we do at CareMessage, I'd like to share a bit of a personal story. Like many of you, my parents came into this country as immigrants to provide better opportunities for me and my siblings, and I'm really incredibly grateful for that. But they faced significant challenges, right? One of them being the language barrier, which I also experienced as well. So I became their translator, even with the little English that I knew. So like to help them navigate like official documents, parent-teacher meetings, and just like and medical appointments as well. So, but I'm not gonna lie, sometimes I did use it for my own benefit, right? Like during those parent-teacher conferences, and when the teacher would say, "Su hijo tiene que mejorar sus grados," and I'll just tell my mom like, "I'm doing a great job, mom," So sorry, mom, for that. But translating during the doctor appointments was like a different story. Like imagine being 13, trying to explain complex problems or complex medical terms to your parents. Like that part wasn't easy. Looking back, I wonder how we even managed. Like, did my parents make their appointments? Did we get the proper care? So some of those questions are still very lingering. So language barrier is just one piece of a larger issue of health equity. The CDC defines health equity as a state in which everyone has a fair and just opportunity to achieve their highest level of health. Other factors that contribute to this include social determinants of health, education, and also income. And who is affected the most? Low-income families, people with disabilities, rural populations, and also the elderly. So this brings me to the core issue, which language barriers are just one part of a larger problem, which is that the U.S. healthcare system continues to leave behind low-income and historicalized marginalized communities. And as new technologies emerge, they often exclude these populations. Just for example, of the 30 million uninsured Americans, over 50% are people of color. Like Black women are 3 times more likely to die from pregnancy-related causes than white women. And studies show that as few as 20% of patients in these demographics use patient portals, even post-COVID. Ultimately, those who need the most help often struggle the most to just access that basic care they need. So at CareMessage, our mission is to leverage technology to improve health equity for low-income communities. We envision a world where people from these communities achieve health equity through better access to care, improve clinical outcomes, and address social drivers of health. And that's one of the reasons I also joined CareMessage. There was a real opportunity to use my design skills to make meaningful impact, especially for the communities and like families like mine. So how are we accomplishing these goals, right? We focus on outcomes that matter for safety net organizations. For example, increasing access to care for new existing patients through one-on-one messaging and outreach, improving health outcomes with targeted messages, addressing social drivers of health with purpose-built workflows for case management, and increasing operational effectiveness for tools designed for FQHCs and safety net organizations. And when I say safety net organizations, I'm referring to FQHCs, which are federal qualified health centers, free clinics and charitable clinics, tribal health clinics, and community health centers. Some of these organizations are well funded, while others heavily rely on volunteers to operate. So now that you know more about CareMessage, let me tell you about a project that we worked on to expand the language support for the appointments reminders feature. So our language feature is one of the most utilized. It allows health clinics to send appointment reminders to their patients. A front office staff schedules an appointment days or even weeks in advance, while patients receive reminders of their upcoming appointments directly on their phones. Previously, reminders could only be sent in English and Spanish, which left patients who didn't speak these languages reliant to others for translation. This leads to no-shows, low response rates, making it one of the most requested customer feedbacks. So we made it a priority to expand language access. Our goal was to help clinics send appointment reminders in languages beyond English and Spanish to reach a broader patient base and hopefully improve response rates and reduce no-shows. So we started with really trying to understand the problem, right? We spoke with customers about how they manage language barriers, how they use our current appointments feature. Some had creative and workarounds like pasting translated messages directly into the English text box. For example, one of our customers was using our feature to coordinate food deliveries for those in need. They relied on Google Translate for their outreach messages as well as their inbound messages. They couldn't afford any delays. We learned that while many clinics had in-house translation services, they still couldn't send translated messages to their patients. We also conducted a survey revealing demand for expanded language support. For example, 27% of our customers wanted an additional language. 51% requested two to four additional languages, and 22% requested five and more additional languages. We were also able to identify some of the most requested languages like Arabic, French, Mandarin, Haitian, and Korean. In addition, many of our customers need to send messages to the minority populations they serve. Some patients don't speak English or Spanish and may not really understand the message they receive. By expanding language support, we expect to see improved metrics for specific demographics, higher response rates, more appointments being kept, and hopefully increase health awareness as well. And ultimately, this helps even more gaps in patients, especially those that are very vulnerable and vulnerable groups. So why does it matter, right? Like, it all ties back to health equity, right? People with limited English proficiencies are less likely to have a regular healthcare provider, have fewer physician visits, undergo fewer screenings like blood pressure, cancer screenings. Additionally, language barriers can lead to increased hospitalizations, longer stays, and even a higher mortality rates as well. There could also be some legal requirements. In the United States, for example, there are federal laws that require certain healthcare providers to provide language assistance to patients with limited English proficiency. Like the Civil Rights Act of 1964 and the Affordable Act, both contain provisions related to language assistance for patients. Providing language support can help these organizations also comply with these legal requirements. So once we identified the pain points and needs, for a customer in our customer journey, we also uncovered issues within our user experience for our app, right? For our web app. For example, like our system messages were only available in English and Spanish. The RSVP message which captures the patient responses was also limited to English and Spanish. Tags that supported like dates and time, were just only English and Spanish as well too. So there were other few challenges that we also were able to uncover. And then with this in mind, we were set out to hopefully bridge the gap. So the first thing we did is really partner with a nonprofit translation service to translate all of our system messages, which include like error messages, yes or no responses, multiple choice options. These messages are now sent in the patient's preferred language, creating more a cohesive patient experience. For example, if a patient replies with an invalid response, the system will automatically send that message in their preferred language. Additionally, we translated like all of our smart text, right? Like day and month. So there's no confusion when patients receive their messages in their language, right? So like after all, like why would you send an appointment reminder in Vietnamese but then leave the month in English in English, right? We wanted to make sure that the whole experience for the patient was cohesive. So we also added the ability to translate inbound messages, making it easier for clinics to respond to patients without needing someone else to translate. From our research, we learned that it often took customers a lot of time to get these messages translated by a translation service or just another staff member, which causes delays and overlooked messages. With this new enhancement, staff can now take action on their own without having to rely on others. This update also included support for over 60 additional languages, covering most of our customers' language needs. And finally, we gave customers the option to update their appointment templates to include more language options, and be able to reuse them again and again. This enhancement to the appointment reminders allow customers to add new languages without needing to copy and paste translations into the English text box, ensuring that the patient data always remains accurate for them. So in summary, we now fully support 60 plus languages for system messages and templates. We translated 12 critical error messages, added the ability for inbound translation, We implemented dynamic smart text for months and days, supporting 60 plus languages. And then now thousands of patients now receive appointment reminders in their preferred language. Also, we didn't just implement the inbound translation for the appointment reminders. We extended it to other features as well. So it's giving the customers access to a functionality across the entire platform. As for the patient experience, they receive messages in their preferred language. The transition between pre-translated system messages and customer provided translations just happens seamlessly. So there you go. Hopefully a much more better experience for the patient. So while it's easy to measure like success and metrics and data, for us, just knowing that a tío or a tía, a cousin, a grandparent no longer has to rely on someone else to translate their appointment reminders, to us is incredible heartwarming. Additionally, our customers are not able to respond to patients more quickly and with greater confidence. Earlier this year, during our company retreat in Atlanta, we visited a customer, a community organization. And while there, I had a conversation with one of the directors who shared that the language expansion had made a significant positive impact on their workflow. As of now, we have processed 242,000 total related responses and 123,000 unique patients who have received translated responses. So that's roughly about 2 messages per patient. And we really look forward to just keep growing these numbers. So to close, I want to say that health equity isn't just a healthcare issue. It's really a community issue. Language access is just like one piece of the larger puzzle. And also, I just wanted to mention that for those new designers trying to break into tech, don't get discouraged. Keep pushing forward. And all it takes is that one person to say yes. And I also want to say thank you to Techqueria for allowing me to share my story and the incredible work that our team is doing at CareMessage, for building and also for building such a great community. Because without them, I wouldn't have found CareMessage at all. And lastly, if you do want to learn more about us and our mission, just please visit our website, caremessage.org, and and get more information about us. I really appreciate everybody's time. Thank you. Gracias. I'm happy also to answer any questions as well too, related to my journey as well too, the story, and just trying to break into tech. I know it's very difficult out there at the moment with what's happening in tech, but again, just don't get discouraged. Just keep going, keep pushing. Again, you just need that one person to say yes, right? Yeah, reading this comment about language access is so important. Yeah. I think one of the things here is we totally want to understand the pain from the customer's perspective. But a lot of that also has to do with even looking at our user, like our sort of user experience as well too, and trying to enhance our product. It's for people who work in tech, it's not when you create a feature, it's not as easy just creating it, right? There's all these complexities like tech deck, and so there's a lot of things that we need to sort of figure out to be able to like make it work. But I'm glad that we were able to at least get this out for our customers, and be able to send those messages and receive those messages from their patients, and be able to just take quick actions as well, right? Like you don't want to wait 2-3 days for somebody else to translate those messages for you. You want to be able to get those messages, be able to translate them, and then be able to respond back to your patients, so they don't need to wait. And again, when it comes to healthcare, those needs are much more at a higher level, right? But there could also be some other ones where the patient just couldn't make it because he didn't have a ride, or he or she didn't have a ride to get to the clinic, right? But if the customers are able to translate that, or able to somehow manage a way to get them to the clinic, then they could do so, right? But they are able to do that because they're able to translate those messages fairly quickly. Awesome. Thank you, Thank you, Kimberly. Yeah. Any currently? Oh, I see some familiar names. Vanessa, thank you so much. She was a previous project manager at CareMessage. Are there any current designers at the moment right now that are trying to transition into getting their first tech roles? Oh, that's a good question, Kimberly. Yeah. So I think, I don't know, something that we pride ourselves at CareMessage is that we're constantly listening to our customers and, customer feedback. And this was something that was really highly requested. And I think not just from customers, but from like our sales team and the CS team. So we definitely made it a priority. So I think it was easier to hopefully, sort of push, this project. And I think, but also in addition to that, I think we also sort of pride ourselves in that, as a nonprofit company as well too. I don't think I mentioned that during the presentation. We do really care about the patients. We do really care about the outcomes and the impact that we're doing with our, with patients. So we're not just trying to, cover a metric for a business, or metrics are not tied to like our business goals or trying to make more money. So I think that's another huge positive of just working here with CareMessage is that, we really want to make an impact. We really want to make, a product and solutions that are actually impacting patients. So hopefully that answers the question. I think it wasn't such a difficult barrier to get to work on this, but yeah, that's a good question. Okay. Civic Tech Special Travel. Okay, yeah. Yeah. Unfortunately, I should have probably got some resources, maybe ready, but I could definitely, maybe put some resources together. At the moment, we sort of just work with, in the healthcare space, so a lot of like FQHCs, free and charitable clinics. So a lot of the sort of work that I've been doing and have been mostly with, with healthcare. Yeah. Gabriel, that's a good question. Yeah. I know we're still. I think we're sort of like a mid-sized team still. So I think there is a lot of opportunities for us to sort of, be able to make some changes and sort of change the culture. I think there's two designers at the moment at CareMessage, and we're constantly providing feedback, and it doesn't seem like it just goes out in the air and then doesn't get listened to. I think like, for the most part, our ideas, and when we push ideas and we push new solutions, for the most part, they're heard and hopefully implemented throughout the year and in these projects that we want to work with. But for myself, I think, I don't know. Yeah, I think for the most part, again, the management has been pretty good to be able to listen to us and our ideas, and be able to implement them and support us throughout the year and throughout these projects. Oh, engineering to design. Yeah. Are you in? Why are you interested in design? Is there a specific topic that you're interested in design? Hmm. Yeah, yeah. One thing that I maybe I wanted to say before I hop off, and uh, when it comes to, I guess now as somebody who's been in the tech field now for a couple of years now, and sort of experiencing that first sort of trying to get my first role, and it was very difficult. I think one thing that I would probably share with everybody is that try to, kind of give back and provide and spend time with people that, you reach out to you and sort of want to ask questions and sort of just need some assistance, because during my sort of transition as well to trying to get my first role, there were some specific people that even without me asking, like they kind of seemed like, oh, this guy needs help, or this guy wants to answer two questions, and they were there to help me and sort of answer these questions for me. when I needed it the most. So even now, when people reach out to me or want to ask certain questions or they want to meet one-on-one with me, I'm always happy to like talk to them or get on a call with them and give them advice to, sort of the journey here, because it's a super tough path, especially now. Like I can't even imagine now and sort of the trying to transition to tech. So but yeah, I would always, suggest that if somebody reached out to you, just be kind to them and answer their questions and help them as much as possible. Awesome. Well, thank you all so much for being here today. I'm really thankful for again for Techqueria for giving me the time here to share my story and the work they were doing at CareMessage. So hope you all have a great rest of your day. Thank you.